Wisconsin has suspended administrative rules and directives in its Medicaid program. This comes through an emergency order, number 35, from Wisconsin's Governor Tony Evers and Department of Health Services Secretary-designee Andrea Palm. The order is actually quite comprehensive, and it impacts many families and individuals through the Medicaid program, but also through other programs, public health department programs, Medicaid eligibility and benefit management, food share administration, the Birth to 3 program, adult long-term care services, emergency mental health, and more. But today we're just going to focus on that Medicaid provision that's included in this emergency order that impacts Medicaid eligibility. This is what the order says. The Department of Health Services shall maintain Medicaid eligibility for persons who were enrolled on March 18th, 2020 or after. This is authority that comes from the Families First Coronavirus Response Act, as approved by the Wisconsin legislature and the Centers for Medicare and Medicaid Services. This essentially means that Wisconsin cannot remove anybody from the Medicaid program unless they specifically request to be removed themselves. So this could be someone doesn't pay their premiums. Normally, they might be removed from the Medicaid program. That's not the case under this emergency order. It could also mean that someone maybe was being sanctioned through the Medicaid program for non-cooperation with one of the program rules. That individual as well, under this emergency order, is required to stay enrolled in the Medicaid program. The thinking is that this Medicaid coverage is going to be so critical during the coronavirus pandemic that we need to maintain our Medicaid roster to make sure that those people can get quick and efficient care and have it be covered should they need it. It also means that Wisconsin gets enhanced federal money by following these rules. That FMAP provision, we've talked about this in a separate video. The Families First Coronavirus Response Act included a provision that says the federal government can enhance its share to states in the Medicaid program funding that they get if the states follow certain rules. They can't change eligibility standards or be more restrictive than they would have had on the books as of the start of the calendar year. They can't charge new premiums. They can't charge copays. They can't terminate people off of Medicaid or make it harder for someone to join Medicaid for the first time. And they can't have cost sharing for any testing services or treatments for COVID-19. Those were the rules states had to follow to get the enhanced Medicaid money. That's where this emergency order comes in, through that maintenance of effort that you can't have anybody leave the program unless they specifically request it, if you want to get that federal money. Now, also included in this order, and we're going to talk about some other provisions in separate videos since it is so comprehensive, but there is a reminder of some other changes that Wisconsin Medicaid program will be following. It's suspending the requirement of submitting verification items in Medicaid. It suspends both the work requirement and premiums in the MAP program, that Medicaid Assistance Purchase Plan. It suspends the Medicaid deductible certification period, and it also suspends the time to request a fair hearing and have one conducted through the Medicaid program. Wisconsin's Governor Tony Evers said, during these challenging times, it is imperative that we preserve medical, mental health, and behavioral health services. And he continues to say this order, this emergency order number 35, reduces the regulatory burden while allowing us to maintain essential Medicaid services and ensure the health and safety of Wisconsinites. We link to this emergency order in the description below and the press release issued by both the governor and the secretary of the Department of Health Services where these quotes were taken. All of this is in the description below.